Well, prior to coming to St. Vincent Healthcare, I was a fellow at the University of Florida, and I saw a great opportunity for this area of the country to come and practice. My wife Erica actually grew up in Salt Lake City and then spent her summers in West Yellowstone, so we were attracted to this area. I had several friends who were general surgeons here and had really great things to say about practicing in this area. So I saw it as an opportunity, both from a personal standpoint in terms of a place that we like to live, but also in terms of a practice standpoint in that I really knew that I could come here and further develop the vascular program that was here. Well, vascular surgery is it's a combination of both medicine and also surgical procedure. So most of our patients have a fair number of other comorbidities, other health problems, and you have to be able to manage those at the same time as also managing their surgical disease. The hospital has a really rich history with my senior partner, Dr. Tim Dernbach, coming from Texas Heart a number of years ago. And the infrastructure and the care that was already being given here was already at a very, very high level. Vascular surgeons who are finishing their training now tend to have a slightly different skill set in that most of the procedures we're doing now are wire and catheter-based. So although those procedures were being done here, the number and the type of procedures that we were doing via an open surgical technique can now be done in a less invasive wire or catheter-based technique. If you look at how we fix abdominal aortic aneurysms, that's probably the best example. A perfect open abdominal aortic aneurysm done on an elective basis is a 5-day hospitalization stay and a very large incision on the patient's midline. It typically takes about 3 months to fully recover. But now with the use of aortic stent grafts, which we can also place without even using incisions in the groins, we just do it with punctures in the groins, the procedure takes about 45 minutes and the patients go home the next day. Montana is it's a very enjoyable environment to both live and to practice. It's just very easy to live here, and the people. You know, I've lived in several other states. I've been in several other training programs, and the people are just very easy to communicate with, and they're very willing to listen to your recommendations and advice, and they have a fair amount of trust that they place in you pretty much right from the start, and I think that may be different from some other places where I practice. So it actually makes coming to work and coming to clinic a joy.